now is Senator and doctor and old friend, Senator John Barrasso of Wyoming, and California Congressman Devin Nunes. Senator Barrasso, let's start with you. You're also a physician. Every time someone has an ache and pain on Capitol Hill, they call you up. So why not have Congress come back to ask some of these questions about the metrics that we're using, the studies that we're using, given what's at stake for our country if this shutdown goes on much past April 30th?
The president called me this morning, and his number one concern, of course, is the health and safety of the American people. And we have just passed the largest bill in the history of the United States that the president signed, the CARES Act, aimed at providing our medical caregivers everything that they need, taking care of our families, our small businesses, and our hard-hit sectors. What we need to do is make sure that is implemented properly. The last thing we need to do is to pass another bill on top of that. We need to make sure, and I'm visiting with hospital administrators and doctors in Wyoming and small business owners, this is where I need to be making sure that this $2 trillion bill is implemented properly.
Congressman Nunes, you heard that during the pandemic of 1918, during World War II, Congress was in session almost continuously, very few breaks. And I know everybody wants to get home with their families, but I mean, we have Americans who are freaking out either from getting this disease, virus, or from losing their job and never getting it back. And they're not sure what the ultimate success rate will look like. And they're legitimate questions that people are having. Thoughts?
Well, look, I think it is important that we get back as soon as possible. But as Senator Barrasso said, right now we still have an issue that most people and employers and employees don't understand, that employers get 2 weeks of sick leave. Still a lot of businesses still have not implemented that. That's a way to keep 2 weeks of everybody still working. That's part of the money that we did in phase 1. People don't understand that. In phase 2 that we just passed last week, 2.5 times the payroll that businesses can go and borrow and get that money ultimately turned into a grant. So I am dealing with all of these issues, trying to get this message out. And I think, quite frankly, all of America's politicians and the media need to stop looking at the death counters. And I think you're very right. We need to look at the death rate. Let's see what that's going to do. We need a lot more data. But let's stop looking at the death counters and let's talk about how we can keep as many people employed as possible. That's the key right now, Laura, because if you don't, what you said earlier is correct. When you have people staying at home, not taking care of themselves, you will end up with a hell of a lot more people dying by other causes than you will by the coronavirus.
Senator Barrasso, there was a moment at yesterday's press briefing that a lot of people had their eyebrows raised after watching it. I want to play it for you and get your reaction. Let's watch.
Roadmap also talks about doing GPS for social distancing, maybe following people's phones, and hotels for isolation for people, giving them free hotel rooms. Are those ideas that you're looking at?
Well, the GPS, that's a very severe idea. I've been hearing about it, GPS. So what happens? A siren goes off if you get too close to somebody? That's pretty severe. But take a look. I just received it a little while ago. He sent it over.
Well, he's talking about the roadmap to recovery that the former FDA commissioner wrote over at AEI. He sits on a bunch of pharma boards as well, which is fine. But part of that roadmap included a possible GPS tracking, Senator Barrasso, of individuals under these state lockdown orders. Do you support in any way the administration ever going even close to that? The president certainly didn't seem to believe that would be something we would require.
Well, I agree with the president. No, I don't think we ought to go that way. Look, this coronavirus has impacted the lives and the livelihoods of so many. It should not impede on our liberties as American citizens. So I'd be opposed to what they're doing, what the recommendation is. They're talking actually about doing that in Europe. That's been written about as well. I just can't imagine the American people would be willing to do that. I think the most important thing we could do, and you've been really good at pointing this out in terms of jumping ahead of this, is doing the kind of research that's being done with all of these different medicines. There are about 5 different medicines that are being tested, not the old scientific double-blind, give them a sugar pill approach. See what is working in the field, even if it isn't a cure. These are medicines that are available and we know are safe because people have been taking them for years. And even if they don't give a full cure, if they can lessen the symptoms or get somebody back healthy sooner, I think that is going to be the breakthrough much sooner than a vaccine, which even the quickest vaccines can take 2 or 3 years to develop.
Yeah, well, just back to that Gottlieb's roadmap that the White House, Fauci, and they're tight and they really rely on Gottlieb's advice. He basically says we can't go back to a normal life until we have a vaccine. That's basically what he says. That would be not going back to normal life, Congressman Nunes, for 12 months. Which if parents across the country are hearing that, and workers, they're going to be showing up in Washington, even if y'all aren't here, okay? They're going to be coming to Washington to send y'all a message.
Yeah, that's not going to work. I mean, look, the schools were just canceled out here in California, which is, way overkill. I mean, it's possible kids could have went back to school in 2 weeks to 4 weeks, but they just canceled the rest of the schools. So, look, I'm optimistic here. I think that the drugs that are on the market now, look how quick we were able to get this approved, this new malaria drug that you've been talking about every night. There's a lot of optimism here that we have in some of these drugs that are coming online. The vaccines are going to take a while. But look, we have this bill that we just passed last week, $2.2 trillion worth. We have to focus on keeping people employed. I will tell you this, if we don't start to get people back to work in this country over the next week to 2 weeks, I don't believe we can wait until the end of April. I just don't know of any economy that's ever survived where you unplug the entire economy and expect things to go back and be normal. So, the more tests that are out there, the more people that are getting testing, let's learn about the treatments, let's get good data as to who's being impacted, and let's figure out a way to get back to work.
All right, Senator and Dr. Barrasso and Congressman Nunes, great to see you both. Stay safe out there.
Good to be with you.
Thank you.